Hello, I'm Dr. Sarah, an orthopedic specialist. Today, I'll briefly explain knee replacement surgery in a simple and reassuring way. We want you to understand exactly how this procedure can help you. Knee replacement surgery, also called knee arthroplasty, is a procedure where a damaged knee joint is replaced with an artificial one. It's commonly recommended for patients with severe pain or stiffness. This is often due to chronic arthritis or a significant injury that hasn't responded to other treatments. Understanding the why behind the surgery is the first step toward recovery. Over time, the protective cartilage in your knee can wear down, causing bones to rub against each other. This leads to persistent pain, swelling, and a significant difficulty in moving through your daily life. When medications and physical therapy no longer provide the relief you need, surgery becomes an effective option. During the procedure, the damaged parts of the bone and cartilage are carefully removed. They are then replaced with a prosthetic joint made of high-grade metal and very durable medical plastic. The ultimate goal of this surgical intervention is to restore smooth movement and significantly reduce your pain. We use the latest technology to ensure the fit is precise and the results are long-lasting. Most patients start walking with assistance within just a day or two after the surgery is complete. With proper physiotherapy, many patients return to their normal daily activities within just a few weeks. Consistency with your exercises is the key to a successful and fast recovery process. Like any surgery, there are some risks, but they are uncommon and very manageable with our care team. If knee pain is affecting your life, consult a specialist today. Thank you for watching.